My name is Allison Payne, and I will be demonstrating and explaining my restraint checkoff. When applying a restraint, a doctor's orders is always necessary. Upon entering a patient's room, perform hand hygiene and identify yourself. Then identify the patient using two forms of identifiers, their name and their birth date compared to their hospital band. Then explain the procedure to the patient and/or family member. Assess the patient for underlying agitation and cognitive impairment. Then assess their current behavior. When you're ready to begin, place the bed at a proper height and lower the railing. Check the patient's skin integrity, circulation, and range of motion. Apply the restraint and secure the restraint ties to a non-movable part of the bed with a quick release knot. Then check for constriction by placing two fingers under the restraint, and when you're done, lift the railing and perform hand hygiene. Restraints must be checked every hour for changes in skin integrity, circulation, and range of motion. Restraints must be removed every 2 hours to reposition the patient and evaluate the patient. I will now demonstrate a quick release knot. Okay, and then you will check that it is secure and release. Different types of restraints. A mitten restraint prevents scratching, removal of medical devices and/or dressings, and it allows greater movement than a wrist restraint. To apply a mitten restraint, you simply place it over the hand and secure to the wrist, ensuring that it is not secured to the forearm, but to the wrist. A belt restraint is to prevent a patient from sitting up on the stretcher, falling off the stretcher, or rolling out of bed. To apply a belt restraint, you assist the patient to a sitting position. Apply the belt over the clothing or gown at the waist, ensuring that it does not slide to the chest cavity or abdomen because it can impair ventilation. Then make sure there are no wrinkles in the gown or clothing. Bring the ties of the belt restraint through the slots in the belt and assist patient to a lying position. Check that the restraints are secure and use two fingers to check under the restraint for constriction. When an infant or child requires restraints, a mummy wrap using a blanket or sheet effectively controls his or her movements.